Good afternoon. This is Dan Hollis speaking to you today from the headquarters of Ascendant Naturals. At this point, I haven't been able to see how many people are online with us. If you've just come online, please type something into your chat box, and we'll get going here in a few seconds. We're very excited about this presentation this afternoon, and hope you'll walk away with a real understanding of what this opportunity is all about and a high level of confidence that we can deliver on the promises we make. At this point, I'd like to go ahead and begin the formal presentation, and I'll start with a recap of the business model and a discussion of the various things that we're going to do as a company to build shareholder value. And for that, I'd like to switch to this PowerPoint. I'm assuming that everyone can see the PowerPoint at this point. And I just want to make the opening remarks that all of what we do is science-based. None of this is based on conjecture. There are over 15,000 peer-reviewed, double-blind clinical trials behind the projects that we're taking on. And we're focused on one thing: improving the quality of health for the patients that we serve. And to you today as an investor, as a potential investor, there's a unique opportunity. Our business segment has been growing at a rate of 15% plus on a compound annual growth rate basis. Now that's a little deceptive. The nutraceuticals market has been growing at a rate of about 8 to 12% per year for the last 10 years. The CBD and MMJ business is growing at an astronomical rate, projected to go from $2 billion last year to $20 billion by 2018. So there's significant upside potential in both markets, and we think by leveraging the power of the nutraceuticals movement and the MMJ movement, particularly with CBD, which is cannabidiol, the non-psychoactive component of MMJ, that we'll be able to produce a product that is in strong demand and creates a margin that gives us a significant upside in terms of our business valuation. Now, one of the things that makes this an attractive business opportunity is that you can't turn on the TV anywhere in America today and not hear about some change in the medical marijuana legislation. 27 states have approved medical marijuana. Medical marijuana is being accepted, and this movement is only going to grow over the next 3 years. The other important thing is that the nutraceuticals distribution models are established, they're strong, they're repeatable, and sustainable. If you build a good nutraceuticals product, your reorder rate is very, very high. And I'll come back to that in just a second. If you're like me, you've heard 1,000 different business pitches, and there are some things that I'll share with you that I think make this one if not different, I believe worth paying attention to. The first is that the significant growth of the MMJ business is going to create extraordinary opportunities for people who approach that business from a true business standpoint and not from the standpoint of being, quote, in the medical marijuana business. Eventually, this will become more pharmaceutical-like and less homegrown, and we think that there's an early opportunity to establish a leadership position, particularly as it relates to CBD, and to make ourselves both a profitable, fast-growth company, but also an attractive potential acquisition for one of the groups that will aggregate these businesses in the next 5 years. Now, we think that we've built an optimized business plan for a handful of reasons. One is our products are unique. There are people who have nice nutraceuticals formulas. There are people who have nice CBD formulas. But to date, no one's been able to solve the riddle of putting together a nutraceuticals product with a CBD product that is bioavailable, bioactive, and absorbable. We've worked through the kinks in that, and I'll share that with you in a few minutes. Now, we've also optimized our business plan by using marketing that's proven to work. We're not cutting any new ground. We're not trying to be pioneers. We're making sure that as we do things that are systematized, that are reproducible and scalable based on significantly proven digital marketing models, which means that our distribution model itself is as cost effective as it can get. One of the things that will separate us from many of the nutraceuticals, and at this point, most all of the CBD products or MMJ products, is our ability to get clinical trials done quickly. We developed a relationship with a group out of the University of the West Indies that I'll share with you in a few minutes that will allow us to get clinical trial data that demonstrates the efficacy of our products in a very fast, very timely, and very predictable fashion at an inexpensive cost relative to most clinical trials. And then the fourth thing that we're doing is that we've spent over a year researching the science on what we're bringing to the nutraceuticals world. We have commissioned a book on the use of CBD and MMJ by a well-known PhD. We've created a CME course for both CBD and MMJ that's been approved for continuing medical education credits by the AMA. So we're very excited about what this product and what these products are going to be able to do for people. And then last but not least, we've partnered with players who have the expertise and the motivation and the capacity to reproduce the success that they've had with other brands, with our brands. And when I say expertise, they've built $25+ million businesses in short periods of time. They're motivated because of the fee-based and equity-based compensation that we're giving them, and they have the capacity, meaning that they have the unused bench strength to help us reproduce our success on their platforms very fast. So who are we going to be patterning in our process? What's one of the leverage points for you? Well, the first one is that we're using a company called Health Products Academy as our lead marketing consultant. Health Profits developed a brand called RealDose.com, which they grew to over $20 million in 18 months. They have consulted for over 3 dozen successful brands and have built many of those to over $20 million in periods of 2 to 3 years. Our marketing agency is SEO Brand. They developed $100 million of revenue with private label Nutra.com over a 7-year period, taking them from just at 10 million to 100 million in 7 years. They've got a similar success story with a company called Health Trim. And then we're following the path of a Dr. Al Sears, who has a product line called primalforce.net. He's grown his business from 0 to $25 million in the last 5 years. So we're not trying to establish new territory. We're trying to leverage off the success of the people that we work with. And if you don't know anything about CBD, here's a new factoid for you. Every human being has a system called the endocannabinoid system. The endocannabinoid system, it's a signaling system that tells the other systems in the body to either speed up or slow down. And if you have endocannabinoid deficiency, that is, your endocannabinoid system is functioning suboptimally, typically you'll see that reflected as disease states. And you'll see that conditions like Alzheimer's, chronic traumatic encephalopathy, with being punch drunk as fighters get, or multiple sclerosis, all those have some component of clinical endocannabinoid deficiency. Now, one of the things that you'll learn about CBD is that in addition to acting as a therapeutic agent itself, it also increases the effectiveness of many of the therapeutic agents that it's combined with. So if you take CBD with a non-steroidal anti-inflammatory, you should see more anti-inflammatory result than if you were doing it by itself. So some of the places that this entourage effect makes all sorts of sense is in pain relief, anti-nausea, brain protection, fighting neurodegenerative diseases, and in certain cancers. So this entourage effect is very, very powerful and only newly discovered. We've known about the entourage effect for only about the last 5 years. And we're working with scientists who understand it and have been at the forefront of beginning to do research on the entourage effect. So let's talk about the size of our market for a second. We isolated the target populations that might benefit from a nutraceuticals product that contains CBD. And if you look, anyone who's had more than 2 head traumas is at a higher risk for dementia and for Alzheimer's. We know that CBD has an anti-inflammatory effect on the brain, and there are some 25 million people who fall into this category in the U.S. Anyone who's had cancer, by definition, has a compromised endocannabinoid compromised endocannabinoid system. And today there are over 15 million cancer survivors in the U.S. People with lung disease, that's everything from asthma to chronic obstructive pulmonary disease, COPD, benefit from CBD supplementation. That's 20 million potential users. There are implications for the use of CBD in heart disease, GI issues, certainly in neurological issues where we've seen a lot of press over the last 2 years, and in treating depression. That's about a third of the people in the United States who are potential users of the nutraceutical formulations that we would combine using CBD to produce immunity guard, brain guard, a gastro GI guard, and a cardiac guard. We're very excited about the size of the market, but the size of the market doesn't make much difference if you don't know how to get from concept to actually selling product. So our goal is to develop the combination formulas that leverage the entourage effect for these specific conditions, and then to isolate and target those populations, marketing and distributing our formulation, who have people who have houses on fire. And by that I mean people who have issues that need to be dealt with urgently. People who have diseases that left unchecked will wreak havoc on their lives. There are literally millions of people who need these products, and it's our job to get to them. And then once we get to them, it's our job to make sure that they receive the long-term education to go along with their treatment regimens to actually restore them to health, so that we can help them produce outcomes which are measurable, demonstrable, and reproducible. So how do we do that? Well, the first thing, if you look at the way pharmaceuticals companies roll out new drugs, you understand that they do 2 things. The first thing they do is educate healthcare professionals. They generally have to work with the regulators, and then they go to the general public and to groups that have a special situation, that have houses on fire. So we're going to use exactly this same process to take our new products and our education programs in a rollout that focuses first on physicians by bringing them the CMA, the continuing medical education courses that we've already had approved by the AMA, by reaching out to them in professional journals, white papers, reaching out to the specialist organizations, and launching these special products into groups of healthcare providers, such as each of them who need immune support on a favorable cost basis. And once we do that, we'll then reach out to the general public by a handful of digital means, which you'll see on the slide, including community building and social networking, where patients actually have the ability to talk to one another and to really reach one another and to support both the product that they're taking and the education that they're receiving. And I want to pause here. One of the things that we're doing with regard to this public outreach is that we've established a relationship that will allow us to get our products talked about on the major television networks. Our goal is to have a large enough footprint that we can leverage the relationships that we already have to be on national TV, on programs like Dr. Phil, Dr. Oz, The Doctors, within the first quarter of 2016. Once we get to that point, you'll see an extraordinary amount of growth that will occur based on the resulting publicity that comes from being associated with shows like that. So what happens when we do all this? Well, the first thing is that we produce a recurring revenue model. We're not out to get a patient and sell them once. We want people to come back and come back and come back and come back. And if you want to know the company that's done that the best, one of them is lifeextension.org, who combines monthly magazines with rollouts of new products and support for their products, both new and existing, on an ongoing basis. They have a model where when they get a customer, they can predict an average lifetime value in excess of $2,000. That's the model that we want, because our cost to acquire a patient is substantially lower than $100 a patient. So you can tell that with an acquisition cost of less than $100 and a lifetime value of approaching $3,000, that on a case-by-case basis, we should be very profitable. We also will establish, in addition to just the sales of supplements, a patient education model that will include a customized 12-month pathway to health, where we'll take whatever condition the patient has, combine it with the supplements that we're giving them, and provide them with a 12-month plan to enhance their health. Now, we're not physicians, we don't prescribe, or we don't treat, but there are educational things that we can do that will support patient health through education. And then we dovetail that through combining communities where people can support one another to enhance their healing process. So we really have a three-part customer subscription and retention strategy that we plan to target a $3,000 lifetime value per customer. And we think that's a very doable process. And by the way, while I'm here, we think that our average cost of goods sold on a per unit basis will be 20% or less. Our marketing cost will be around 15%, and our corporate SG&A will be around 5 to 10%. So this is a very, very cost-effective business structure. So how do we roll it out? We've already published our CME courses. We'll begin building out community sites as we launch our products out. We'll do specialized digital outreach to cohorts that are easily identifiable. And then we'll bring out ebooks customized to each of those specialized cohorts as we launch our new nutraceutical formulas. We got 4 books that'll come out this year, 4 ebooks that'll come out this year. We got four products that we'll sell. By the way, we are currently selling products. You can go to www.ascendantnaturals.com and see our products. We'll be rolling out our first major launch of that site the first of next month. We plan to certify physicians in the 20 major metropolitan areas to begin and eventually begin to attract patients to clinics that will certify as having achieved clinical competency, and then we'll provide tracking data for each patient if the physician wants it. So what do? In 2015, our growth strategy is to establish the position of authority with the CBD manual being published, continuing to publish our CME courses, publish consumer guides, and generate recurring revenue in our nutraceuticals and our patient communities, and establish the basis for continued growth. That's our tactical goal for 2015. Now, we also, in addition to organic growth, believe that there will be acquisitions that are available for us that can be very beneficial to the growth and profitability of the company. We've acquired the rights to a company called Favio, which has a hangover relief medicine, which, while not interesting in and of itself, actually does constitute a $2 billion market. Favio is an interesting brand for a couple of reasons. It already has revenue. It's already being sold in Walgreens. It was developed by a team of experts that include world-known physicians, biochemists, and the former formulator of Coca-Cola Fanta. Our science experts really constitute a who's who of being able to formulate CBD product. And we're very, very excited about that. Our physician is actually one of the leaders in a group of physicians who doing work down in the Caribbean, doing some exciting clinical research, and has a really deep understanding of the use of medical marijuana and CBD. And so we'll add CBD and conduct clinical trials to the Favio product in Q4 of 2015 at the University of the West Indies. And then our intention past there is to repurpose the formula for cancer patients. And as I said, this product's already generating revenue at Walgreens. We're in about 5% of their stores, and we'll roll it out on a much broader basis throughout the balance of this year and going into next year. And we're in discussion with CVS and Cormark currently. So this is an acquisition that brings us immediate cash flow, significant potential upside, a world-renowned group of physicians, biochemists, and formulators to help us optimize this product and create new products on an ongoing basis. So what are our financial targets? We think that in the last quarter of this year, we can generate well over $1 million. 2010, our target is $10 million. And this is based on the growth patterns that we've had projected to us by our partners. We think that $10 million in 2016 grows to $25 million in 2017. We don't think we'll have more than 15 million shares outstanding at that point. And we think that that'll create a really nice revenue per share and earnings per share, and should produce a nice return for our investors in a relatively safe fashion in a very, very quick manner. So when I look at companies that are in this market, I ask myself, who's winning and who's losing? There's a company called Earth Science Technology. Earth Science has a $40 million market cap. They have no revenues and less intellectual property that we own from the outset. We think that as we take this company public, our first goal will be to get this to $15 million market cap, and I think we can do certainly by the end of second quarter next year, and perhaps much sooner. And I think that our ability to grow to a $40 million market cap by the end of next year is actually on point. An outlier in this comparables analysis is GW Pharmaceuticals. GW is a British company that was also ran as a pharmaceuticals company until it began to publicize the fact that they were building out product using CBD and components of MMJ. Their market cap has soared over the last 18 months. They've got significant amounts of intellectual property, but their $1.4 billion market cap comes on only $42 million of revenue. So we think there's potential for a well-executed, well-thought-out plan to be well-received in the investor community. So our foundation for growth is we've got the intellectual property to be able to bring out new products that are exactly what patients with the conditions that we described earlier need. We'll bring out we have 4 formulations out now. We'll bring out another 8 in 2016. We're building a distribution network that's digitally based, focused on physicians and consumers and special interest groups. And we've built a clinical trial network that will give us unique positioning in the marketplace to continue to build our business. So summary, we think that Ascendant Nutraceuticals, I hope we've developed for you at this point that there's a large market for the products that we are currently selling and intend to sell in the future, and that those markets are sustainable based on the chronic diseases that we'll confront. Because we're using a digital distribution system, we're highly capital efficient, we're going into proven business models, and we've got a great team of people around us that have proven track records. We like to think of CBD bringing us top of the mind awareness, nutraceuticals being a growing business. All we really want to do is make sure that we build nice recurring streams of revenue for Ascendant Naturals, our current CBD line, our Favio brand that we're bringing out, and our patient education and cohort communities. Now, the feedback loop on our webinar isn't working as it's supposed to. So on this particular webinar, I won't be able to take questions. But I would invite you to give me a call at 404-414-8800 if you have questions or comments. And you may also email me at dan@danhollis. I want to thank you for your time this afternoon and look forward to speaking with you soon. Thank you.